Hi guys, Dr. Kim here. Daphne has volunteered to go see Dr. Terrell in his mobile veterinary clinic today for her annual checkup so that you guys can come along and see how it looks. Let's go see. So today we're going to give you the opportunity to come along as Dr. Terrell, a local small animal veterinarian in the League City area, provides a well pet exam in his mobile veterinary practice. This fully functional mobile animal hospital can bring medical care to pets and home. Here's our patient Daphne on the scale getting ready for her examination. Got to monitor body weight to look for any signs of illness. Dr. Terrell and Stefan, his assistant, are getting the vaccinations drawn up. So Daphne's up on the exam table, ready to get her physical exam. So Dr. Terrell has got the otoscope, and he's going to start by checking out her ears and make sure everything's nice and clean there. You can see that Stefan is helping to hold Daphne to assist Dr. Terrell in being able to examine her. Veterinarians in all types of practice really depend on the skill and assistance of their technicians to help them do their job. Next, Dr. Terrell is going to look at Daphne's eyes. Not sure if she's on board with the plan, but I think she's behaving herself pretty well. Now he's checking her mouth. When you look in a pet's mouth, you have to look at their gum color to make sure they don't look like they're pale or anemic, and then also look at their teeth. Are they missing any teeth? Are there any fractures of the teeth? How is the health of the gums? Is she in need of dental cleaning? So now he's going to use his stethoscope, and he's going to do what's called a thoracic auscultation. That is listening carefully to the heart and lungs. He's looking for any abnormal sounds, any abnormal rate or rhythm of the heart, listening for good breath sounds, making sure everything sounds good. And in the medical chart, once he gets his heart rate, he will post that as well. That's something that can be monitored over time to make sure that there's no abnormalities occurring. You may notice also Stefan places his hand gently over Daphne's muzzle to make sure she's not panting, and that helps him be able to hear better. All right. Everything sounds good. So now Dr. Terrell is grabbing some alcohol, and we're going to move in a little closer. Stefan is holding off, what we call holding off Daphne's leg. He's going to draw a blood sample today, and this is a routine part of a wellness exam for dogs in our area. He's drawing a blood sample to do a heartworm test. Heartworms are a parasite that's prevalent in the Gulf Coast region. It's carried by mosquitoes, and it definitely affects dogs and sometimes cats, and it can have deadly consequences. So we want to test them every year to make sure that they do not have heartworms. If we find that they do, then there is a treatment available for that. Having a negative test ensures that your dog is able to safely be on the preventative medicine. Preventative medicine is really easy. It's just a chewable treat that they take once a month, and that keeps them from getting heartworms. So that is really important for any of you dog owners in the Gulf Coast area. So Dr. Terrell's getting the test down out of his inventory shelf up there and getting everything set up. Okay, so Dr. Terrell is just getting a little stool sample from Daphne now at this point. Basically, there's a lot of parasites on the Gulf Coast with the humid climate. Dogs and cats can carry parasites, and they're passed in their stool, and that can be a health problem not only for pets but also for people. So as a responsible pet owner, we want to get our pets checked once a year and make sure everything is good, not only for their health but for the health of people around them. So now at this point, Daphne's getting her physical exam finished up. Dr. Terrell is palpating her abdomen. That means feeling around in her belly for any lumps or bumps or any painful enlarged organs that shouldn't be there. With that process, her physical exam is complete and she's going to be ready to receive her vaccinations. The vaccines that Daphne is getting today are rabies, distemper, parvo, bordetella, and leptospirosis. Rabies, of course, is a vaccine that is required by law, and that is because that has human health significance as well. The remainder of the vaccinations are not necessarily required by law, but are definitely required if you want to keep your dog healthy. Leptospirosis is an example also of a zoonotic disease. That means an illness that animals and people can both get and can give to one another. So it's very important that not only for our pets' health's sake, but also for the sake of people around them, that we get our animals vaccinated and keep up with their wellness checks. So Daphne is relaxing after her physical exam, and we are waiting on the lab tests. Here you see a device called an autoclave. This is used to steam sterilize instruments, and there's our lab tests. They have to sit for the appropriate amount of time before they can be read out, and Stefan is busy working on the medical record. While we're waiting on the lab tests, we wanted to show you that Dr. Terrell's mobile veterinary hospital is also equipped to be able to do surgeries. You can see there's surgery light and surgery table. There's an anesthetic machine. For this purpose, we just have a little stuffed dog to demonstrate what it would look like when a patient is hooked onto the anesthesia machine in the surgery suite. Stefan is ready to read out those lab tests. You can see that there's a microscope and also some other lab equipment sitting next to him, and Daphne is eagerly awaiting her results. Everything looked great for you today, Daphne. All your lab tests look good. It's time to go home and relax. So thanks so much to my good friend Dr. Terrell for taking care of Daphne today and letting us video and come along to see what it's like to be a mobile practice small animal veterinarian. I just wanted to spend a couple of minutes talking to you guys a little bit about veterinary education. So if you decide you want to go and become a veterinarian, what's involved? Obviously, after high school, you go to college. Most people attain a 4-year undergraduate degree that doesn't necessarily have to be in animal health or in science, but it does need to include the prerequisites required to apply. That is a list of certain, usually math and science classes that are required by vet schools to apply to vet school. Once you get to that point, then you apply and gain acceptance to vet school. There are 33 accredited vet schools within the United States. 2 of them are here in Texas. Those are Texas A&M and Texas Tech. Vet school itself is a 4-year program. Upon graduation, you can go directly into practice, or you can choose to continue your education to specialize, say if you want to be a surgeon, for example. The cost of vet school will vary with what school you're going to. In-state tuition is always more economical. For example, Texas A&M Vet School currently projects $25,000 a year for your in-state tuition versus $38,000 a year if you're a student from out of state and you don't have Texas residency. So one other thing that would be helpful for you to know is what kind of salary can I make being a veterinarian? As you can see, the graph here gives information about annual salary for full-time associate veterinarians by years of experience. If you look carefully, you can see that you can earn a better salary with more experience as you go, but even at the start of 5 years or fewer experience, the average starting salary is about $80,000 a year. Associate veterinarian means a veterinarian that is working at a practice that they don't own. So just so you have that information. But one thing to remember is that if you're interested in possibly pursuing a career in veterinary medicine, it is never too early to start, even as a 7th or 8th grader. Make sure you strive for academic success, place emphasis on math and science courses, get as many of those courses as you can, and definitely go and gain experience working with animals. You can join the FFA, 4-H, or volunteer at your local animal shelter. I hope that this presentation has been fun and helpful to you, and I appreciate you listening. Thanks so much.